One of the biggest mistakes we see in our practice is the patient that has a low back injury, and they come in and they're not patient with the progress of getting that better. There is a big difference between a low back injury and just say your kind of standard low back pain. We get a lot of patients come in with just some mild to moderate back pain, no real cause to it. It only happened a couple days ago. That can, usually get better pretty quickly. But sometimes you sustain a back injury, just like if you had a knee injury or an ankle injury, like it can take a little bit of time and you have to be patient with that. If you're in a lot of pain or you did something that caused it, if you're getting leg symptoms, if you can have a hard time walking with it, if it's really a low back injury, a big mistake is people expect it to go away maybe after a visit or two. Sometimes it happens, it's great. But when you sustain a low back injury, this can be a 3 to 4 week process for you to get better. And yeah, you may need some pain medication or muscle relaxers. I'll let you, determine that with your medical doctor. But ultimately, with conservative care, the importance of it is to actually obviously get you out of pain, but then to fix what caused that. There's a reason why you had that low back injury. And so sometimes when you've gotten it to that point where it's injured, the pain may not go away in a visit or two. You may get some relief and it come back. We might go 3 or 4 visits with not a lot of relief, but then by visit 5, we have a breakthrough. And so usually that 3 to 4 weeks we need to have to get you some pain relief, get the muscles to loosen up a little bit, to where your back doesn't feel vulnerable anymore, to where you feel like you're fully functional again. Like it's a little bit of a process. And if the pain doesn't go away in a visit or two, it doesn't mean you're on the right track. Too many people give up on it and they end up just maybe only taking the medications or running out for MRIs, and maybe they end up down a surgical route they really didn't need if they were patient in that conservative process. Now, after 4 weeks or so, we're just not making a dent in it. It's not getting better. That's where maybe there's some alternative options for you to get there. But if you sustain a back injury or any other type of injury, be patient with it, do the at-home care, and you will get better. But just know that if you've injured your back, you are now in an episode of back pain that might last for a few weeks. And it's just a blip in the radar. You're going to get better and ultimately you'll do fine. But be patient with it. Do all the things you need to get rid of the pain and improve the function, and you'll do fine. If you're dealing with back pain or any other types of injury, call our office and we can help you out. We can evaluate you and treat you on the same day. Call us at 561-997-8898 or visit our website at healthfitchiro.com and you can schedule online.